If you're suffering with back pain and really unsure about what to do, this video is for you. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Lucan in Dublin. Back pain is such a debilitating thing in your life. It can hang on for far longer than it should, and there's so much misinformation out there, it can be difficult to know exactly what to do and where to go. If you Google back pain, lots of scary information comes up. A lot of the time, if you go to healthcare professionals, while they're very well intended, there will also be a lot of misinformation there. And that's quite powerful because it can create a fear, and when you experience that pain, after a few weeks or months, you can still be stuck in pain with really no answers, and you can feel a little bit lost. Because ongoing back pain does not need any extra input from a therapist or anyone in terms of, say, needles like acupuncture or dry needling or traction or manual therapy, it can be sorted by you understanding it better and moving again. In this video, I'm going to give you several exercises that you can start doing at home to help yourself, just so they make a little bit more sense for you. Going through one of the factors that contributes to ongoing back pain is a build-up of excessive tension around this trunk area. Now, a lot of people try core work for this, but you already have a lot of tension in your back muscles, and then things like Pilates or anything that increases the tension there can make you feel stiff and sore either during it or afterwards. And then you think, oh well, exercise isn't for me because I'm trying to work on my core. This is a different approach here. Think of it this way. If you hold your hand up like this and tense all the muscles around your fist, you can do that for a while, but you couldn't do it for too long without feeling tired and stiff and sore and achy. So you'd have to loosen it and get it moving again. That's a very obvious example of what we're going to do with your back muscles. In people with ongoing back pain, one of the common findings that we see is that the trunk muscles, the muscles in your low back, are on all the time. They're doing a lot more work than they should, and then they become tense, and tense muscles become sore and weak and tired. So you experience your pain there and you really aren't sure what to do. We're going to change things around. It involves two things: loosening out the muscles in your back and also getting the muscles in your legs and hips doing the work. So it's two factors, and we're going to hit those in the exercises that we cover here. Before we get into the exercises, it's really important that you ask yourself two questions when you're doing it. Am I breathing, and are my muscles relaxed? A lot of people do these and they're very, very tense. The whole purpose is to get rid of the tension in that area. That's very difficult to do. It sounds quite simple, but as you're doing all of these exercises and all of your movements, just ask yourself, am I actually relaxed here, or am I a little bit tense? No one can change that except for you, which is such a good thing because you can sort this out yourself. So let's get straight into the exercises. So you're trying to get your back to be able to relax and stretch those muscles. So asking yourself those two questions: am I breathing, am I relaxed? Your hips up against the wall, slight bend in the knees, putting your hands on your thighs like this. Lead with your head, so you're not going to do it with your head up. Tuck your chin and just slide your hands down your shins and back up. Slide your hands down your shins and back up. Tuck your chin. When you come back up, try and come back up nice and rounded as well, so you're not coming back up with a stiff low back like this. So breathe and relax. Just go as far as you can. And you're really just trying to do relaxed, loose movement. So as we mentioned with back pain, a lot of the time the back muscles are doing everything and the leg muscles aren't doing what they're supposed to be doing. So a lot of people with ongoing back pain will get up from a chair like this. So they're using their hands and they're keeping their back nice and stiff. That can contribute to it being achy. What should be getting you up off the ground? It's really your legs. So breathe, relax, and try and keep your back muscles relaxed. And then I want you to really focus on pushing down through your feet. So that's what you're thinking about. You can breathe out if it's a challenge for you. So keeping your back relaxed, pushing your feet down into the ground. Now, you might think, oh, I have a little bit of back pain. It's fine, keep going with that. As you start to feel your legs working a bit more, your back pain will loosen out and improve. Pushing your feet into the ground, trying to get these legs working. So the key is get the legs working, keep your back nice and relaxed. You pick a number, 20 or 30, wherever your starting point is, and try to do that frequently. So you're loosening out your back, but then you're getting your legs working. Okay, so we're going to try and keep the back relaxed and get the muscles in the leg working. So you're down on the ground like this, hands on your ankle. All the effort has been done by this front foot. I'm going to slide my hands all the way up and all the way down, so your hands stay in contact with your leg. So pushing down through here. At the top, my head can look straight ahead, and then it's looking down. Now, if you look at my back as I'm doing this, my back is staying relaxed. I am not trying to keep it straight and rigid, and I can increase the intensity. And as I start to go here, I can feel a lot of work into this leg. If I want to make it a bit more difficult, what you can do is pause after 5 or 10. Stay relaxed, both hands beside the knee. Very little pressure to the back leg, and I'm starting to feel a lot of work here. And then I can go back to it. You decide how many you do, then go on to the other leg. But I want to encourage you to feel this working, and all the time, your back is staying nice and relaxed. We've done relaxed movement with your back bending, but your back also needs to be able to rotate. Think of examples in your life when you have to rotate and bend and pick something or reach for something. So, relaxed, loose, thoughtless movement. That's key. And so try not to do it very rigid. Keeping this area relaxed like we've covered in the video. Let your head follow your hands. And even if it's a little sore, just try and do it as relaxed as you can. You're absolutely safe with this exercise. Again, decide how many you do, 30 seconds, and you're trying to do that frequently during your day. Those videos are very simple and easy to do, but don't confuse simple and easy with ineffective. They're purposefully chosen so that you can do these yourself at home or in your office without too much disruption in your day. A lot of people suffer a little back pain, are busy, they have other things to do, and it's difficult to carve out a half an hour or an hour to get a lot of things done for yourself. You don't have to do that. They're the exercises. You know the 2 questions you're going to ask yourself as you're doing it. Am I breathing, and am I doing this with my muscles relaxed? But apart from those exercises, as we know, back pain is multifactorial. There are lots of other factors that can contribute to your back pain hanging around and getting more sensitized or getting a little bit better. So general movement and exercise is beneficial. It doesn't matter exactly what it is. Something as simple as walking can be really good. Don't underestimate the power of going for a 20 or 30 minute walk at lunchtime. If that's something you're not doing and you're staying sitting at your desk, that's an area for you to improve on. Other factors like sleep and tiredness also contribute to your back pain getting worse, or if you're getting more sleep, it can contribute to it feeling better again. Again, these are things that are somewhat in your control, so there's some power there for you to sort that out. Stress is talked about a lot, and it can be a factor, but stress is really only a factor if you have no outlet for stress. So that's what we're going to do in these videos, is to try and get you back moving again, back doing the exercises and activities that have meaning to you in your life. If you have any questions on any of this, feel free to comment below or reach out, and we'd be glad to help.